very briefly what the difference between these two devices are, and then I will jump in to how to treat your patient's anxiety, insomnia, and depression with cranial electrotherapy stimulation, or CES. So both of these devices that you see here, the AID and the ILM, will do CES and will treat anxiety, insomnia, and depression. And I'll show you in this presentation how we do that. The difference between the two devices is that the Alpha-Stim ILM also utilizes technology called microcurrent electrical therapy to treat pain peripherally on the body. Now, I'm focusing on CES since we're mostly behavioral health providers here. The information I'm giving you is just a small tip of the iceberg. It's just a little teaser on what we have. I also offer hour-long webinars about once a week to let you get certification in Alpha-Stim and learn more about how it works and what the research is, and more about the protocols. All right, but having said that, let's get started. So cranial electrotherapy stimulation involves the application of minute level of electrical currents applied transcranially across the brain. With the Alpha-Stim, that is done with ear clips that are attached to the earlobes. Other devices use other techniques. CES is FDA cleared to treat anxiety, depression, and insomnia. Now, one thing I like about this, there's a lot of things I like. I use that phrase a lot when I'm presenting. Just one thing I like, another thing I like. You're going to find out there's not much I don't like about this device. But the effects are often immediate. And what I mean by that is I would have veterans that, had been suffering from chronic and severe anxiety, pain, all of that. Some of them were Vietnam vets, some were more Desert Storm. But regardless, the point is they've been suffering for decades. They had tried medications, they had tried everything that the VA threw at them. I'd put this device on them, and within 5 minutes, you could just see them relax. And they would report, "Oh man, I haven't felt this good in years. I haven't felt this relaxed. I don't remember the last time I felt this relaxed." Unlike other devices and medications, there's no lasting side effects. We will talk about the safety of the device. Unlike most medications, there's no risk of addiction or accommodation. In fact, just the opposite. The effects of Alpha-Stim are cumulative. So the more consecutive days you use the device, the better results you're going to get and the longer they're going to last. It is very, very easy to use, and it is an evidence-based treatment. We have well over 100 clinical studies on these cleared indications with this device. And then we also we've been on the market for 41 years. So we have reams of real world data as well to show how safe and effective this device is. Now, I mentioned it's easy to use. It's very simple. All you do is wet the electrode pads on the ear clip electrodes with the included conducting solution. You place them on your earlobes as close to the jawline as you can get. Turn the device on, and then you set it to a comfortable current for 20 to 60 minutes. That's it. You can do the treatment pretty much anywhere. You don't have to be in a doctor's office. You don't have to be at your home. We wear ours at the office quite a bit. My CEO will hop on her treadmill and wear her Alpha-Stim while she's, walking on the treadmill in the morning. So it's not something you got to carve time out of your day to do. But I mentioned find a comfortable current level. So the way you do that is when you turn the device on, it will always default to a 1, which you see on the screen. That corresponds to 100 microamps. You increase the current slowly. You're going to start to notice a little tingling or pulsing sensation on the earlobe. I'm not worried about that unless it becomes uncomfortable. If it becomes uncomfortable, turn it down. But if you're just noticing it, then keep going, turn it up until you do feel some kind of discomfort. Most people will feel a little lightheaded, like they just, they stood up out of a chair too quickly, or a little unsteady, like they're standing on a boat in the water. Once you feel that, that's an indication that the current is just a little too high for your nervous system for that treatment session. So turn it down until that goes completely away. And then you repeat this process for every treatment. And that's because the current level that you need, that your nervous system needs, can change from one treatment session to the next. Now, once you've found the comfortable current level, that will determine how long you need to treat. So if that current is at 2.5 or higher on the screen, which is 250 microamps or more, then 20 minutes is often enough time to get a complete treatment. If you're between 100 and 200 microamps, then you're going to need about 60 minutes to get a complete treatment. So the correct dose for an Alpha-Stim treatment is an inverse relationship between the level of current and the amount of time needed. You're going to get the same treatment at 400 microamps for 20 minutes that you're getting at 1 for 60 minutes. So trying to go higher than you can do comfortably is not going to give you a more effective treatment, and trying to treat longer than recommended is not going to give you a more effective treatment. One of the nice things about this device, and one of the more confusing things for patients, is that it's designed to be subsensory. Some people will not be able to feel even the tingling on their earlobes, even when they turn it all the way up. You're still getting benefits, even if you're not physically feeling anything. And like I mentioned earlier, you can do pretty much whatever you like while you're doing an Alpha-Stim treatment. We do, however, ask that you not drive or operate machinery. A couple of reasons. One, there is a wire that goes from the ear clips to the device, and that wire has a way of just getting in the way when you're trying to do things, and I don't want it interfering with you trying to make a turn or something in your car. The other thing is, especially in the initial sessions, what Alpha-Stim is doing, and I'll show you this when we get into how it works, is we're automatically inducing an alpha state. And for a lot of people, that involves kind of a head rush, kind of relaxed feeling. And we involuntarily kind of close our eyes when that happens. And again, I don't want you doing that if you're behind the wheel of a car. Most people, when they start an Alpha-Stim treatment, within a few minutes, they begin to feel very relaxed, very calm, but they're also notice that they feel very alert and focused. Most patients will describe feeling as if they slept all night. I had one patient call in and say that she felt like she had 8 hours sleep and then drank 2 cups of coffee. So, that's what we're looking for most people. However, there is a minority of people who, especially in the first 1 or 2 treatment sessions, are going to experience a very heavy, groggy feeling. I compare it to, like, if you've ever been out in the sun all day, whether you were, out like by the pool or working in the yard, something like that. And then you come in and you sit down and your whole body's just exhausted. Your arm and legs feel heavy. Feels like it's hard to form a complete thought. Feels like it takes a lot of effort to do anything. That's what this feels like. You never want to stop a treatment with somebody feeling that way. So even if they've gone the 20 minutes or 60 minutes or whatever, based on how, what their current requires, sometimes you may need to just treat a little bit longer. So if they feel that way at the end of the session, turn the device back on. Oftentimes they only need about 3 to 5 more minutes. They start to feel this very light, calm, relaxed, focused feeling. And then about 2 minutes after that begins, you can turn the device off and they should be fine. Okay. Now, Alpha-Stim is effective for about 85–90% of people. So about, roughly 9 out of 10 people. So if somebody's not getting a benefit from it, their knee jerk is always to say, oh, well, I must be that 10th person. The odds are actually pretty much against you on that. So chances are, if you're not getting a benefit from Alpha-Stim, it's one of these things on the screen that either you're stopping therapy too soon. Sometimes we see that patients who have a chronic condition, whether it's anxiety or pain or whatever, Alpha-Stim will put that condition back into an acute phase, and it feels as if the symptoms have gotten worse. When they call us in clinical support and report that, they get really confused and we're like, oh, that's a good sign. It means it's working. Just keep treating. So if any change with Alpha-Stim, whether it's, a temporary increase in symptoms or definitely obviously a decrease in symptoms is what we're looking for. But any change is an indication that we are having an effect on the nervous system. You need to keep treating to get the full benefits. However, the most common reason I see that people tell me Alpha-Stim isn't working for them is that they're just not noticing small improvements. So either, they're expecting this miraculous, oh, I'm going to put this on and I'm going to feel amazing right away. Or, they were doing a little bit better and then maybe they had a bad, day with their depression or anxiety, or they didn't sleep well that night or whatever. And so they conclude that, oh, well, this isn't working for me. I saw this a few times when I was at the VA. Veterans would try to bring the device back, claiming that it wasn't working for them. And a family member who was almost always with them would look at them and go, that's why you're here? No, 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 you've been much easier to live with. They weren't that polite. But they're like, you've been much easier to live with since starting this thing. You are not giving it back. So, you know, when you start somebody on Alpha-Stim treatment, try to do some kind of objective screening, you know, the PHQ-2 or, you know, BDIs or something to get, you know, symptoms so you can show them when they're having a bad day. No, look, you have been doing better. Or at the very least, see if you can get some collateral data from their patients. So now that I've explained how to use Alpha-Stim and what to expect from it, let's talk about how it works. One of the things I love best about Alpha-Stim is that we're not forcing a specific type of change within the nervous system. That's one of the things that makes Alpha-Stim and CES unique. What we're doing is helping the nervous system restore this homeostasis. So I say the key word in an Alpha-Stim treatment is balance, and I'll show you what that means. So we all know the nervous system is electrochemical in nature. We all know that the receptors can be activated by chemicals, and then that receptor acts upon the cell the way the receptor is designed to, and the way the neurotransmitter or medication molecule or whatever influences the receptor to do so. But those same receptors can also be activated with electrical or biological frequency, and it's very similar to our near field communication technology. So the example I like to use is when I walk out to my car, my key fob is in my pocket. It's broadcasting a frequency. My car recognizes the frequency, and as I approach, the lights come on. I can open the doors, get in, start the car, do anything I need to do. Never have to physically put a key in an ignition or a lock or anything like that. But if I'm walking out with, let's say, 5 or 6 coworkers, and we all have key fobs, and we're all sending our signals, our frequencies to our cars, their frequencies are not going to activate my car, and my frequency is not going to activate theirs. So it's very specific. And that's the way the receptors on the nerve cells work, is they're tuned to specific frequencies. And when the frequency that matches the resonance that the receptor is tuned to comes in contact with it, then it acts upon the cell the same way it would have if a neurotransmitter or a medication molecule or whatever had activated it. But any other frequency that comes by that receptor is completely ignored. And that is the secret behind Alpha-Stim. What we're doing is using microcurrent to transmit this patented waveform that you see on the screen into the nervous system. This waveform uses the square waves that you see to generate a wide range of biological frequencies or harmonics. And these frequencies travel along the nerve cells and activate the receptors the way I described on the previous slide. So basically, if a cell is hyperactive, then the frequencies that would activate the receptors that calm that nerve cell down get activated. Other receptors are bypassed with no effect. Conversely, if a cell is underactive, which you often see like with depression, then the frequencies that would stimulate that nerve cell are the ones that are activated, activate the receptors. All other frequencies are ignored. So that's how Alpha-Stim is able to do both. And I'll show you research that shows that in a moment. A couple other things I want to point out about our waveform. This is a patented waveform. No other device can have this waveform. But I want you to notice that before each square wave, there's a spike. These spikes are designed to disrupt the electrical resistance in the skin and allow us to transmit this waveform at much lower levels of current and much slower frequencies than other devices. They have to use higher levels of current and much faster frequencies to hammer past the skin resistance. And then finally note that this waveform is transmitted at 0.5 hertz. It's a very slow frequency. It takes 10 seconds for this waveform to enter the nervous system at that frequency. And that's important because you want to give the waveform time to generate as many harmonics as possible. Faster frequencies compress the waveform and you don't get as many harmonics. As I mentioned earlier, Alpha-Stim is automatically inducing an alpha state. And this EEG study shows this. After a single 20-minute session, there were significant increases in the alpha wave frequencies, which of course leads you to that nice, calm, relaxed, very tranquil feeling. Simultaneously, there are often significant decreases in the delta wave activity, especially the frontal lobe right behind the eyes. Delta waves, of course, are associated with feeling fatigued and drowsy and sleepy. And so by decreasing those, Alpha-Stim is helping you feel very alert and focused. And this is what I find a lot when I do a demonstration at a convention or a conference. Usually what we do is just let them borrow the device and take it with them to the next presentation they're going to. And then when they come back to us and give us a device back, we always ask how they're feeling. And they almost always say, oh man, I felt very relaxed, very calm, but I also noticed it was very easy to focus. It was easier to pay attention to the speaker this time. And that's exactly the effect we're looking for. Now, unlike other neurostimulation devices, focused ultrasound, deep brain stimulation, vagal nerve stimulators like that, Alpha-Stim is not focusing on a specific neural pathway or a specific area of the brain, and we're not focusing on a specific frequency. We take more of a global approach. And so as you can see from this Loretta imaging, the alpha wave activity, the increase in alpha wave activity was pretty much all across the brain. And then in this bottom row, you can see it penetrated pretty deeply into the structures of the brain as well. So it really is a global approach. And then we have fMRI studies that show that we do indeed balance the brain. We have a calming effect on the brains of anxiety and pain patients. And then one study that did show literal balancing or normalization of the brain activity. And then this study looked at the effects of Alpha-Stim at 0.5 hertz or 100 hertz. Now our Alpha-Stim M model does have a setting for 100 hertz. And when you're treating pain, there's very specific reasons for that. But we wanted to see what would happen if someone tried to do a CES treatment at 100 hertz, because that waveform is so compressed that you're not really getting any harmonics. And what they found was, if you look at the top line here, top row of pictures, the blue is the calming or deactivation effect of hyperactive areas of the brain at 0.5 hertz. The yellow is at 100 hertz. So you can see it's a much broader effect on the brain at 0.5. And then the bottom row is the positive activation, and that only occurred at 0.5 hertz. So you never want to treat the brain at 100 hertz. Always use 0.5 setting if you're using an M. And then a typical course of treatment for an Alpha-Stim is to use it daily for 3 to 6 weeks. And then, if you're starting to feel better, you can start to taper down if you want. We have a lot of people, including a lot of coworkers here, that continue to use it every single day, and that's perfectly fine. But generally what we see is that anxiety and pain, we have significant reductions in the first treatment, and then you just get cumulative results after that. Depression typically takes about 3 to 6 weeks of daily treatment to see a response, and up to 12 weeks before you start to approach remission. And then with insomnia, some users will sleep incredibly well from the first treatment on. Some will sleep really well for a couple of nights, and their sleeping issues kind of creep back in for about 4 to 6 weeks. And then others, it just takes 4 to 6 weeks of treatment for patients to begin to experience relief. And again, even longer to kind of get more significant results. Everybody responds differently to Alpha-Stim treatment. And so there is a little bit of trial and error to see what your sweet spot for the treatment is. Now, one thing we do recommend is, because of that decrease in delta wave activity that I showed you on the previous slide, we recommend that you not treat at least 3 hours before going to bed until you see how Alpha-Stim is going to affect you. For people that it does cause that decrease in delta waves, they've described it to me as feeling as if somebody just flipped a switch and they're on. They're not sleepy, they're not going to sleep, they're not ruminating, they're not lying there with their mind racing. they're just not going to sleep until those delta waves kind of naturally build back up. I have talked to people that have to treat by 8 o'clock in the morning if they want to sleep that night. I've also talked to people, my wife is one, she can put the device on, go to sleep and sleep great all night long. So again, everybody responds differently. So there's that little bit of trial and error to see how you or your patients are going to respond. Now let's take a look at the research. I did mention we have well over 100 studies. Obviously, I'm not going to go through all of them, just kind of hit some of our highlights. This was a random controlled trial, double-blind, sham-controlled study. And as you can see, the active group reported 3 times more improvement than the sham group. And about 84% of the active group reported at least a 50% improvement in their anxiety symptoms. And I challenge you to find a medication study with numbers anywhere near that, especially in just 5 weeks, and also with no reported side effects. Now you do see here this slight improvement in the sham group. That of course is a placebo effect. Naturally, we see that in any human trial. One of the things I like about Alpha-Stim research specifically is that we do see that slight improvement, and then it flatlines because they're not actually getting a treatment, whereas the active group always has that cumulative effect that you can see. So this was the results of anxiety. These are the results of depression. This time the active group had 12 times more improvement than the sham group. And again, well over 80% had at least a 50% improvement in depression symptoms in the active group. Now there was a study that was conducted in the UK. These were on patients who were diagnosed with generalized anxiety disorder. They started through the treatment pathway that NHS requires, which includes self-help bibliotherapy and medications, and then they were on the waiting list for cognitive behavioral therapy, either individual or group therapy. So they were offered 6 to 12 weeks of Alpha-Stim treatment. Most of them opted to do the 12 weeks after the 6-week period, 6-week time frame was over. And then they followed up 12 weeks later. So at week 24 of the study, they followed up. And it's important to keep in mind that there was no treatment in that interim 12 weeks. And what they found with anxiety was that about 44% had achieved remission in the GAD-7 scores within 12 weeks. When they did a follow-up at 24 weeks, about 48% or so had achieved remission. And as you can see, there's a pretty significant improvement in anxiety scores. Same with depression. You saw this incredible improvement, and then just a slight increase after 3 months of no treatment. Same thing with insomnia. As you can see, they were sleeping significantly better at the end of 12 weeks. And then when they came back and followed up at 24 weeks, they were continuing to have improvements in sleep. So once your nervous system gets balanced by Alpha-Stim, it tends to stay balanced until something kind of throws a curveball at it. Okay. Now this study I include for the specific reason of this increase, and I want to explain that to you. So the participants for this study were patients with advanced stages of cancer. They were in a palliative care unit at MD Anderson Hospital in Houston. And they measured pain, insomnia, anxiety, and depression in these patients. And for the other 3, there were very steady decreases all across the board. But with depression, there was a slight increase during week 4. In speaking to the primary investigator, what we have learned is that between taking the measurements for week 3 and the final measurement at week 4, what happened on the board was that there were more deaths than usual. More patients died during that week than had been during the previous 3 weeks. And so if you'll put yourself in the patient's place, you're on a palliative care unit, you're terminally ill, your death is imminent, you're saying goodbye to your family and friends, you're trying to wrap up, get all your affairs in order, all the stuff that goes with end of life. And all of a sudden you start hearing these more frequent reminders that your time is coming. You start hearing all the chaos that occurs on a hospital unit when there's a code. And so you would expect that these patients would feel sadder, that they would feel more depressed. And that's exactly what happened. And that's one of my favorite things about Alpha-Stim, especially using it in therapy, is that unlike medications, and we've all, I'm sure, all had patients that were on so many psych meds that they were just numbed out. They couldn't feel anything. I call them zombies. And it's really hard to reach them emotionally in therapy and get them to process and work through the pain or the anger or the anxiety or the depression or whatever they need to work through to move past what's causing them problems. With Alpha-Stim, you still feel it, but it's not overwhelming. So if you're talking about something that would make you angry, you're going to feel angry. If you're in a situation where you're going to feel anxiety or stress, you're still going to feel that anxiety or stress. It's just not going to be overwhelming. That's one of my favorite things about using Alpha-Stim in a therapy session is I'm able to keep the patient in that moment much longer, and they kind of level out at the end much quicker. Now, I mentioned using Alpha-Stim in therapy. Alpha-Stim works well as a standalone treatment. It also improves the efficacy of standard treatments when used as an adjunct. So this study looked at comparing medications as usual with medications as usual plus an Alpha-Stim. And obviously, as you can see, for both depression and anxiety, clinically, these patients are pretty much the same at the end of 6 weeks. I mean, this isn't something that you're writing home about with your clinical results. But the story here is the journey. Which patient would you rather be? The CES and medication group? Their symptoms got better a lot quicker, and they did not have any more side effects. When used in therapy, the results are just, there's no comparison between trying to do therapy as usual as opposed to doing therapy with an Alpha-Stim. And then again, Alpha-Stim results last. So this study looked at a bunch of different groups, including Alpha-Stim only, medication only, and then they did a 12-month follow-up. And what they found was the medication only group had 3 times more, higher relapse rate than the Alpha-Stim only group had. All right, so now that I've given you kind of a taste of the research, and if you want to know more, all of our research is on our website. But let's talk about the safety of it, because that's one of the things I want to know when I'm considering a treatment for a patient is not only how effective is it, not only, is it evidence-based, what does the research say about it, but I want to know what's it going to do to them? Like, is there anything I need to worry about? And it's practically impossible to harm yourself with an Alpha-Stim. Our side effects are extremely rare, mild, and self-limiting. In our research, we see that about 0.1% will experience a headache, and even fewer will experience some mild skin irritation at the site of the electrodes. In clinical use, looking back over the past 10 years, and I know this because I'm the one who compiled these numbers, the rate of any adverse reaction that was reported to us was 0.11%. And that includes the adverse reactions that people reported that have nothing to do with Alpha-Stim. And sometimes we'll get that. We'll get someone who reports feeling, dizzy from using an Alpha-Stim. And then as we do an investigation and talk to them about it, they're like, oh, well, I have vertigo. I'm dizzy almost every day. Well, that wasn't Alpha-Stim. Okay, that was a pre-existing condition, but we still include that in our numbers. The most common side effects that we do see are headache, vertigo, or nausea, generally an indication that the current is too high. Just turn the current down and that will go away. If you feel that way at any point after a session, turn the device back on, turn the current down below where you had it, and then treat again. And just like with the heavy groggy feeling, 3 to 5 minutes, you generally start to feel better. And then a couple of minutes after that, you can stop. The only exception to that is every now and then the headache is what we call a cervicogenic headache, which means the muscles in the neck and shoulders relaxed unevenly from the treatment, and that will trigger a headache. And if that's the case, just put it on a 1, keep treating. It can take a couple of hours, but then that goes away. But then subsequent treatments after that, you're less likely to experience that type of a headache. As with most other devices or medications, safety of stimulation has not been established during pregnancy. We have real world examples of people who have used Alpha-Stim during pregnancy. I personally know of one woman who used it during both of her pregnancies and used Alpha-Stim as the only method of pain relief during delivery in both pregnancies. So Do your own risk-benefit analysis if you want to use it with someone who's pregnant. But if you call me and ask for my professional opinion, this is the statement I'm going to tell you. And then the only contraindication we have for Alpha-Stim treatment is the presence of an implanted electrical device that can't be turned off. Something like a pacemaker, a defibrillator, a cochlear implant, something like that that just cannot be turned off. If they have that spinal stimulator that can be turned off, then they can just turn it off, do the Alpha-Stim treatment, and then when they need the stimulator again, they can turn it back on. Insulin pumps, pain pumps, the glucose monitors, all of that, perfectly fine to use Alpha-Stim with. All right, so in summary, Alpha-Stim is safe, it's easy to use, it's evidence-based, it works quickly, and it's cumulative. We are FDA cleared, we're CE certified in Europe. Our biggest customers are the DoD and the VA, and we're available to help you now. And just a quick word, if you are interested in using an Alpha-Stim, you can reach out to our local rep there in Utah. His name is David White. His email is dwight@epii.com. And he will be more than happy to get in touch with you. We have a 60-day provider loan so that you can try it out, try it on yourself, your friends, your family, your patients, and then determine if it's going to work for you. All right. Any questions?
I have a question.
All right.
Is it contraindicated in people with seizure disorders?
No, it is not. That's a good question, and it's one that we get often. I went to a brain stimulation conference in December, and I was speaking to someone who does ECT research, and his whole focus is trying to find that the least amount of current possible to trigger that seizure, because you need that for ECT. And when I gave him the outputs that we have, he literally laughed at me. That anybody that we would even consider seizures with this device. So I'm being asked for David's email, so I'm going to type that into the chat.
I have a question. How often would, if we worked with this with our clients, how often would we use it with our clients, and how many sessions would we use it, or is this a ongoing thing with them?
So you can use it. What I would do at the VA is I would do a couple of trials in session, and then I would order one for them, because my VA just ordered it for the veterans. It is a prescription device. You don't need to have like prescription privileges for like medications to order it. We just need a licensed provider's order to be able to send one to a patient. But the best thing is, try it for a couple of times. If it works for them, they can purchase one, and then they can use it every day at home. So, but okay, so we're getting some other questions. Someone asked, what does cleared by FDA mean? FDA has two approaches to basically approving something to be sent to market. You either are cleared by showing that you are essentially the same as a predicate device. In our case, the predicate device is one that was on the market like in the 70s, I believe, and is no longer on the market. Or you can go the pre-market authorization route and do a PMA and get approved. They are virtually identical. In both, you have to prove safety and effectiveness. It's just a different route of getting to market. So that's why we say we're cleared by FDA. And then someone asked, is it appropriate?
Does it mean that it's FDA approved?
No, it is FDA cleared.
Okay. And is it covered by insurance?
So VA will cover it in most cases. TRICARE will cover it. Workman's Comp covers it. Some insurance companies policies will cover it, especially if there's a durable medical equipment rider on it. We are working now with Medicare. We're hoping to get approval, coverage by them this next fiscal year, and then we'll expand from that. So,
what indications? For what indications would it be covered by commercial insurances?
That's going to depend on the policy. I mean, you're safest with anxiety, insomnia, and depression, because that's what the FDA clearances are for. But I know a lot of providers who write for off-label uses as well.
Okay.
So also, if the patient has a flexible spending account or a health savings account, they can use that to purchase it.
And what if is it safe in traumatic brain injuries or history of brain bleeds or any devices in the brain, and like shunts and things like that?
Yes, it is safe. We have 2 TBI studies going on in the VA now, and I've used it with patients with a history of TBI, stroke, all of that with no issues. So someone's asking if it's appropriate for a 45-year-old cerebral palsy with mild pain, anxiety, and depression. Yes, it's not gonna, it'll work well. And then how is 20-minute sessions established? Is there benefit to going more than 20 minutes in a session? So if you're able to treat at 2.5 to 4 on the device, there's really no benefit to going longer than 20 minutes. With rare exceptions, there are people who need to, but it's rare. Whereas if you're between 100, 200 microamps or 1 and 2 on the screen, you're going to need to go 60 minutes, ideally 40 minutes at the least to get a full treatment. So, but more is not better with Alpha-Stim. Ooh, this was a good question. How long do people use this? Months, years, tune-ups? Again, everybody's different. I have talked to people who have used theirs every day for 20-something years. When COVID kicked off and we were all quarantined into our homes, we had a lot of patients call saying that, you know, they've had it in their, you know, desk drawer, dresser drawer or whatever for 10, 15 years. Put new batteries in it, still working. And then we just walk them back through how to use it. So everybody's different. I use mine as needed. I'm not, you know, I don't have, you know, diagnosable anxiety, depression, anything like that, but I have a lot of stress and tension. And so I will use it to help with that when I need it. And it's usually one of my clinical support staff who tell me when I need it, because they'll come in and go, you're doing an awful lot of sighing in your office, which means like everything, when I'm stressed, everything I see is like, so they'll come in and tell me to put the device on. So can we have a copy of the slides? Yes, I can email a copy of PDF version of the slides. It's not a problem. Is there an age restriction? Yes and no. The reason I say that is up until like the last few months, we've never had to put an age restriction on this. And I know of patients as young as 3 years old who are using it, all the way up to, you know, patients in their 90s. Now, you know, FDA and the regulatory agencies in Europe and all that are asking for an age restriction, and the vast majority of our research is on adult populations. So we do say it's for adults. And in the US, adult by the FDA, according to the FDA, is 22 and above. So, but it is safe to use with all ages. Somebody asked for the website for more information, so I've typed that in the chat. Can the device, hold on, let me make sure I'm not missing. So are there addictions? Okay, I'm not sure if you're saying additional studies or addiction studies. I'm going to put my email in here as well. Feel free to shoot me an email with any questions you have. But yeah, somebody put in the stress.org certified product Alpha-Stim. We do have a lot of, they put some off-label research on there for us. Alphastim.com is going to have our on-label, our cleared research. This is a great question. Do you use Alpha-Stim differently for the different disorders? What if a patient has more than one diagnosis? No, with Alpha-Stim, you're treating the person, you're not treating the condition. So it's the same protocol, whether they have, you know, very mild depression or they have full-blown severe chronic insomnia, depression, and anxiety. It's the same protocol. It's, you know, turn it up to the point of feeling uncomfortable, then turn it down 20 to 60 minutes. So Okay, do people build a tolerance to it? No, just the opposite. The effects are cumulative. So the more you use it, the less you actually need it. These are great questions, guys. Can the device be shared? My next question, could it be used for stress? I may need one. I just told you I used it for stress, so I've answered that one. It is an off-label use, obviously, but stress and anxiety are two sides of the same coin, so go for it. Can the device be shared? We know it happens. It is a prescription device, so all we ask is that anyone who's going to use it have a doctor's order for it. You don't have to, doctor's order doesn't mean you have to buy one. If you have one, if your spouse has one and you want to use it, just whoever wrote the order for your spouse, write one for you and you're covered, because it is a prescription device. But yeah, other than that, it's, we take them to conferences all the time. You change out the pads between sessions, wipe down the ear clips with alcohol wipes, and you're good to go. How does it compare to Fisher-Wallace? Fisher-Wallace is, it's the same type of technology. It's cranial electrotherapy stimulation. Fisher-Wallace uses sponges on the temples that are held in place with a headband. And they typically use our research to show that their device works. So that would be like Tylenol saying that they work because Advil has good research on effectiveness. So, definitely look at the research behind whatever devices you're looking at and see whose research holds up. Does this work well with severe depression or anxiety, or more mild to moderate? All. It may take longer with the more severe conditions, because again, it is a very gentle treatment. We're not forcing specific responses, but it does work well with severe depression and anxiety. I've used this with veterans who have combat PTSD with amazing results. Me too. Thank you for treating our veterans. This has helped them tolerate therapy such as cognitive processing, where they could not prior to using the device. Exactly. I had the exact same experience with it. Does it help with headaches, or can it cause headaches? So the only way there's only two ways it would cause a headache. One is if the device, if the current's turned up too high, again, just turn it down, and the headache will go away. The other is, as I mentioned, that cervicogenic headache, where the muscles just didn't relax evenly, in which case just keep wearing it. With headaches, you can use the ear clips to treat a headache, even a migraine. It's off-label, but it does work. But you may need to treat at like a 1 for about 3 hours or so to get rid of that headache. It can take a while. If you're using the Alpha-Stim ILM, which we didn't cover that technology at all, but it uses probes to deliver the current, and you can treat the head with the probes. And I have gotten people from with a migraine so bad that they were, practically, about to run to the toilet and be sick, to no migraine at all in less than 5 minutes. Somebody asked, do you stop other medications or add this to it? You do not have to stop your medications to use an Alpha-Stim. It can have a potentiation effect, so it can make the dose effectively 30% stronger. And so, keep that in mind. They may need to work with a prescriber to lower their medications if necessary. And a lot of patients are able to completely come off their medications after using Alpha-Stim for a while. What is the purchase price? So the price for patients are for the aid, the one that just does the CES, is $840 with a 5-year warranty. The ILM is $1,299, again with a 5-year warranty. There are provider discounts. David can give you more information on that, and there's volume discounts. So if you purchase 5 or more, you get our best discount on a per unit price. And then Jeremy's asking, any research on Alpha-Stim helping pain? Yes, absolutely. We do have a lot of research with Alpha-Stim helping pain, and I've seen it help pain as well. I had a veteran about mid to late 40s that had, I can't remember the exact number, but between 5 and 7 back surgeries already. and walked into a PTSD group one day. And we've all seen these patients on bad pain days where they just walk like they're, in their late 90s, they're barely moving. We put the Alpha-Stim on him in group. He treated for 20 minutes. 40 minutes later, when the group ended, he stood up, looked really confused, sat back down, stood up again, kind of shifted his back around and said, guys, my back doesn't hurt. And they told me the next week, see, that was 9:30 in the morning or so when his treatment ended. He said his back started hurting about 3:30 that afternoon, but he was riding a horse. So, did the Alpha-Stim wear off, or did he just re-aggravate the pain by riding a horse? Someone's asking me to re-explain the difference between the two devices.
Hey, Josh, let me give 1 second here.
Sure.
Let's come back to the questions, but we're getting close to the time. So let me get the evaluation
Okay.
information. So I'm going to leave your screen on, but I just need to copy. So for those of you that are looking for the CE, because we're not live, we've got to do an evaluation form. So here is the link for the evaluation form, and our code word is going to be Alpha-726. So there's the Alpha-726 is the code word that you'll get. And there's the link for the evaluation. For those of you that are kind of new or you have firewalls, sometimes that link won't, your firewalls, your company firewalls will keep you from getting onto Google Forms. If you will email, now I've got to change this too. So with this, we have a little bit of announcement. Today is my last day at the hospital. And our new person that is going to be doing these classes is Joseph Turek. And Joseph, where are you? Why did you drop down? So Joseph is going to be the new one. So Joseph, if you will put in your email. So if you're having an issue, a problem, you can email Joseph. And thank you, Lisa. So I will be joining Life Launch Centers and doing marketing for them. So I'll be talking, you'll see me around at everything. But if you'll email Joseph, he's our new face. There's Joseph's email, and he can help you out. And make sure he will be sending out the invites for future ones. So make sure you recognize that, and you've got so you're not being kicked to junk mail on future classes. So let me ask real quick, is the link working for some? Okay, good. The link's working. And if you have any questions, yeah, just pass on. Joseph will be the one to ask on that. I'll also, okay, good. It's working. So yeah, so we'll get you everything from that. And I'm going to go ahead, Dr. And you can go back and answer questions.
Okay. All right. Yeah, I'll just take a few more minutes. Joseph, is it okay if I send you the PDF of the presentations and everybody?
Yes, send it. Yeah, send it to Joseph.
Thank you. Yeah, I copied your email over, so I'll get that out this afternoon. So the last question I saw, somebody asked about me to re-explain the difference between the two devices. And so I put the picture back up. The Alpha-Stim Aid, the smaller one, only has the ear clips. It only does CES. And so it's cleared for anxiety, insomnia, and depression. The Alpha-Stim M, which is a little bit bigger, also treats pain peripherally in the body through the use of probes or self-adhesive electrodes that we call AStrodes. It goes up a little bit higher, goes up to 600 microamps instead of 500. It also has the ear clips for CES. So the M does everything. The Aid only does the ear clips. And so that's the basic difference. So, and then I saw another question real quick, scroll back up. about compliance. We've had a couple of studies on patient compliance rates, and they were mostly in like residential substance use studies, and they found that using Alpha-Stim kept them in treatment longer than patients who didn't. They were less likely to leave AMA. We also did a survey last year, real world data, and found that out of 300, almost 350 patients who replied to the survey, the average length of ownership was 5 years. Some, obviously it had less, some way more. But most patients, about 85%, were still using it at least 3 times a week, if not, and up to twice daily. And even the ones who, you know, said they were using it less than that were still using it at least once a week. So honestly, generally, once you start using Alpha-Stim and see how well it works, you continue using it. So, all right. And I think that's just about our time. So thank you again for the invitation. I enjoyed it. And if you have any questions, Joseph will have my email and I put it in the chat. Feel free to reach out to me. If you have any questions about how to obtain one or prices, then reach out to David White. So.
And thank you everyone for joining us again. We will be continuing the classes, and Joseph, we have been sending the invites out through Constant Contact, and we'll continue to do that. And everybody, we do have your emails in there. If you are new to the class and we don't have your emails, we did ask that question on the evaluation, and any new emails we can totally add in. Joseph, do you see that? Will you send your email out again? I'll be around again. We'll see everybody. But yes, thank you. Dr. Briley, thanks for joining us today and presenting.
Thank you. It was my pleasure.
We'll see everybody again in 2 weeks, next class. If there's any questions or anything.
Bye.
Good stuff.